So my PowerPoint is over Cleft Palate. Definition is an opening on the roof of the mouth due to failure of palatal shelves to come fully together from either side of the mouth and fuse. So I just have a picture of a baby with a cleft palate, how it would look. So this is formed early on in pregnancy. This is when both sides of the hard palate do not form together and instead is left with a gap in between both sides. So if it's not repaired, it can affect a number of things. Things like troubles eating, swallowing, or just being a high risk for aspiration overall. So cleft palate has several ways of developing: defective growth of palatal shelves, failure of the shelves to attain a horizontal position, lack of contact between shelves, or a rupture after a fusion of shelves. Around 8 weeks gestation, the merging of the palatal shelves are supposed to commence. So for disease process, there are genetic as well as environmental factors to why children can develop a cleft palate. So teratogens like smoking, chromosomal aberrations, Down syndrome, which is why I have a picture right there of a child with Down syndrome, Stickler syndrome, rubella embryopathy, and FAS, fetal alcohol syndrome, and that's the picture to the right. So according to Gantis, orofacial cleft occurs in about 1 in 700 births. Since cleft palate happens in the early stages of life in the womb, there are not a whole lot of clinical manifestations present that would give us an idea that this could be the developmental of cleft palate. But some manifestations for cleft palate consist of nasal deformity, exposed nasal cavity, bilateral or midline cleft that is all the way from the uvula to the hard or soft palate. There are some DNA studies that show us some marked genes that may be affiliated with the cleft palate abnormality, but there's not really any signs or symptoms of cleft palate that we have found. Cleft lip, palate, or both are found to be most common in Asians and Native Americans, and it's actually least common in African Americans. Most cleft lips and palates can be diagnosed in utero by an ultrasound. Cleft palate is distinguished by milk coming from the infant's nose during a feeding. At extreme risk for imbalanced nutrition, since they have formula coming out of their nose each time they eat, they're not going to get the essential nutrition they need from the milk. As the child with cleft palate grows, being able to accurately communicate is vital. That's why the repair of the cleft palate can require many different types of healthcare professionals. They can have lifelong problems like recurrent otitis media and speech problems. So these babies tire easily, so making their feeding time simple and easy is essential so they don't have to lose an excessive amount of weight trying to work for their food. Also, taking breaks between feedings is essential with these children. Using short, soft nipples on the bottles that you're feeding them from, and also being aware of aspiration risks while feeding the child as well as after. Here, I just have a picture out of a textbook of like 2 different nipples you can use for the bottles, and then also a picture of her holding the child at a 45 angle degree. And of course, laying on the back is not the correct position because they could aspirate. Okay. Treatments. So cleft palate repair is usually done between the ages of 6 to 24 months, depending on the child's health status. Repair, usually general anesthesia and a short stay at the hospital. There will be a need for dentition work because of the formation of the mouth during the repair, geneticist for learning how the disease came along, surgeons, nurses, speech therapy, occupational therapist, and ear, nose, and throat specialists are also a part of their care. Here I just have two pictures of what the repair would look like. So on the left, there's a pre and post picture, and then on the right there, it kind of shows how they place the stitches in a zigzag position. You can kind of see that on the other picture as well, the zigzag of the stitches. Okay, so the primary nursing diagnosis I found for this was imbalanced nutrition. And then some interventions also would be using short, wide-tipped nipples for the baby so the milk can flow out easier, and making it so the infant doesn't have to waste their energy trying to suck. Another intervention would be the short and frequent feedings. They have very tiny stomachs, so they tend to eat a lot, but for long periods of time. So cleft palate infants need frequent short feedings to reserve their energy while also getting the adequate nutrition. Also holding the infant in a semi-upright position while feeding, so you can take care of those aspiration risks, as well as guiding the nipple away from the cleft is also vital in preventing aspiration. And then I just have a picture to the right of here of the different types of nipples that you could use with a cleft palate baby. So an NCLEX question: what are some nursing interventions involved with cleft palate care at a newborn? Select all that apply. So the answers would be B, a short wide-tip nipple, and D, allowing the infant to rest. And then the rationale is down below that you guys can read. And then my second NCLEX question: an infant is born with cleft palate. What are some factors that might be the reason of this abnormality? And then the answer is B, drug and alcohol use. And then there's my AP citations.